Good day everyone, we are the group 2 and we're going to discuss about the professional ethics. So for the outline of our discussion, first we will discuss the Code of Ethics of Medical Technology and the second is the Medical Technology Oath. So now let's start the Professional Regulatory Board of Medical Technology Resolution number 72 series of 2022. So this law is approved by Jose Y. Cueto Jr. as the acting chairman and Erwin M. Enad as the commissioner. For the chairman, it's still vacant and this was approved on September 13, 2022. So the Code of Ethics of the Medical Technology Profession was the Section 7 of Republic Act number 5527, also known as the Philippine Medical Technology Act of 1969, as created a Board of Examiners for Medical Technology Board. So next for the Section 11, it states that the board vested with authority to look into conditions affecting the practice of medical technology in the Philippines and, whenever necessary, it adopts such measures as may be deemed proper for the maintenance of good ethics and standards. So, in the practice of medical technology and the draft such rules and regulations as may be necessary to carry out the provisions of the law. So next, the Code of Ethics was first published by the Philippine Association of Medical Technologies or the PAMET in 1968 and later on was revised in 1997. In 2012 and 2014, review of the Code of Ethics for Medical Technology was conducted by the board because the board still find the need to elaborate on some statements and to include other commitments. In 2018 naman, the board formed a committee composed of representatives like various sectors like academe industry and laboratory practitioners. In 2019 naman, the board, together with the committee members, organized the articles or the code into its final draft. However, the onset of the global pandemic in 2020 resulted in the disruption of changes in priority in work of board and the committee. On June 25, 2021 naman, the board and the committee members resumed its work towards the finalization of the code. So in here, I will just highlight the important terms to remember. So this code sets forth the fundamental ethical principle and the professional responsibilities of the medical technologies towards patients, the healthcare system, the community, his or her colleagues, self and the profession, allied professionals, and the health products industry. So now let's proceed to Article 1, which is the general principles. So I will just summarize or highlight the important keys in this section. So for the Section 1, this section emphasizes that the primary objective of medical technologies is to serve humanity without any discrimination based on factors like race, religion, gender, political belief, or medical condition. So for example, a medical technologist provides accurate and timely test results to patients from diverse backgrounds, treating everyone with equal respect and care. For the Section 2 naman, medical technologists are expected to uphold the highest standards of professionalism, excellence, competence, and integrity in their practice. So, A medical technology consistently maintains accurate records, stay updated on advancement in the field, and conduct themselves ethically in all professional interactions. For the Section 3 naman, this section emphasizes that importance of following principles of quality and safety in all aspects of laboratory practice. So, example dyan ay a medical technologist ensures that all laboratory equipments is properly calibrated, follows standardized protocols for specimen, and maintain a clean and safe working environment to prevent accidents. So, for the Section 4 naman, medical technologists are required to prioritize the interest of patients above their own and maintain confidentiality of patient information as per legal regulations. So, example niyan yung a medical technologist handles patient data with utmost confidentiality, ensuring that the only authorized personnel have access to sensitive information. So now let's go to the Section 5. The Section 5 is about accountability and responsibility. So a medical technologist are accountable for their professional and personal conduct and are expected to demonstrate good judgment and behavior to ensure excellent laboratory performance for optimal patient care. So, a medical technologist takes responsibility for any errors in testing procedures, communicates effectively with colleagues and supervisors, and take steps to rectify mistakes to prevent recurrence. So, Section 6 naman, it's about contribution to professional development. So, medical technologists are encouraged to contribute to the advancement of their profession through lifelong learning, self-development, mentorship, and collaboration with relevant organizations. So, a medical technologist attends continuing education workshops, participates in research projects, and mentors junior colleagues to enhance the quality of laboratory services. Ang Section 7 naman is about civic responsibility. So, a medical technologists are expected to maintain allegiance, a sense of civic responsibility towards their community and country. So, parang they should volunteer their time and expertise to provide free health screening in underserved communities, contributing to public health initiatives. So, for the Section 8 naman, it's about respect and collaboration. So, medical technology should treat other professionals with respect and foster cooperation and collaboration among them. So, they should communicate effectively with healthcare providers, pathologists, and other laboratory staff, recognizing their expertise and working collaboratively to achieve common goals. So, for the Section 9 naman it is about avoiding conflict of interest. So, medical technology should refrain from engaging in activities that may give rise to conflicts of interest. So, they should avoid accepting gifts or favors from vendors that could influence purchasing decision, ensuring impartiality and integrity professional dealings.
Now let's talk about Article 2, which is entitled Responsibilities to Patients. This article talks about the medical technologist duties, and obligations to their patients. Now, Section 1 tells us that a medical technologist shall attend to patients faithfully, conscientiously, and timely, and shall secure for them all possible benefits. This section also tells us that a medical technologist shall be polite, courteous, attentive, reassuring, and of course, caring to their patients. Next one is Section 2, which says that a medical technologist shall accurately or dutifully perform his or her tasks regardless of the patient's age, gender, creed, and nationality. So, this basically says that regardless of the patient's age, whether they be a younger or an elderly, or regardless of their gender identity, creed, or nationality, a medical technologist shall perform his or her task. Next one is Section 3, which says that a medical technologist shall seek appropriate assistance according to established protocols in situations beyond his or her knowledge and skills. So, for example, when situations go out of hand of the medical technologist, he or she shall seek appropriate assistance which can be obtained from, for example, medical practitioners, senior medical technologists, of course according to the established protocols. Now let's move on to Section 4, which says that a medical technologist shall keep all patients' information and results obtained with strict confidentiality. This is important, especially in the practice of medicine, because confidentiality preserves individual dignity, it also prevents information misuse, and it protects the autonomous decisions that are made by the patients. This is completely necessary, except when the disclosure of the information is required or needed by pertinent laws, rules, and regulations. And lastly, in Section 5, it tells us that a medical technologist shall only engage in lawful and appropriate procedures that promote the best interests and, of course, the safety of the patient. Now let's talk about Article 3, which is entitled Responsibilities to Self and the Profession. This article tells us that a medical technologist shall personify or embody professionalism, integrity, responsibility, accountability, and competence in the conduct of his or her profession. It also says that a medical technologist shall continuously update and upgrade knowledge and skills, and this is because of the modernization as well as scientific and technical advancements in the profession. Section 3 says that a medical technologist shall ensure compliance with the medtech law and other laws and regulations or regulatory policies related or affecting the practice of the profession. And aside from that, it also tells us that a medical technologist is duty-bound or is required to report to the proper authorities any illegal acts and other violations, including illegal practice, of course, for the profession and protection of the public. To continue Article 3, let us now proceed to Section 5, which highlights the biosafety and biosecurity practices, because this tells us that a medical technologist shall actively support and apply principles, policies, and guidelines for the protection of the environment. This article also says that a medical technologist shall ensure compliance with quality assurance program that follows the standard of good laboratory practice. In Section 7, it tells us that a medical technologist shall engage in community or social work where their services are needed. For examples, in cases of emergency, disaster, or any other similar circumstances. In Section 9, it tells us that a medical technologist shall fulfill their duties and responsibilities through active participation in continuing professional development, which we now know as CPD, to respect the Constitution and bylaws of the last two sections of Article 3 tells us that a medical technologist shall accept reasonable professional fees on matters relative to research, consultancy, and activities that require his or her expertise. It also tells us that he or she shall uphold the dignity of the profession by accepting, carrying out, and discharging the responsibilities inherent to being a professional. Let us proceed to Article 4, which is the responsibilities to colleagues and other professionals. This simply states that a medical technologist shall establish cooperative, honest, and respectful working relationships with other medical technologists. They shall also act in the spirit of fairness and maintain a culture of fellowship. Along with that, medical technologists shall maintain harmonious working relationships with other professionals of different interdisciplinary practice and respect the scopes and limitations of their practice. The professional relationship with the health product industry, or HPI, are discussed under Article 5. This article states that a medical technologist shall collaborate with HPI for the advancement of medical technology and the quality of healthcare services. He or she shall also foster a relationship that encourages the development of a healthcare professional practice that is committed to patients' well-being and is based on truthful, accurate, and updated scientific evidence. Aside from that, they shall also interact with HPI to meet the highest ethical standards, preserve independent decision-making, and uphold public confidence in the integrity of patient care and product and service selection. Sections 4 and 5 of Article 5 highlights the importance of medical technologists collaborating with HPI within the bounds of applicable laws and codes of conduct. It also highlights the collaboration with HPI for professional advancement on new technologies and equipment through education and experiential training. Article 6 are penal revisions. Pursuant to the power of the Board to issue, suspend, and revoke certificates of registration for the practice of medical technology, violation of any section of the Code of Ethics shall constitute unethical and unprofessional conduct, and shall therefore be a sufficient ground to reprimand, suspend, or revoke the certificate of registration of the offending medical technologist in accordance with the provisions of RA number 5527 as amended and Republic Act number 8981, which is the PRC Modernization Act of 2000.
Article 7. Amendments. Amendments to the Code of Ethics may be initiated by the Board in consultation with the accredited professional organization or the APO and other stakeholders. The final proposed amendments shall be submitted for approval by the Board to the Commission. Article 8. Effectivity. The Code of Ethics becomes effective 15 days after being published in the Official Gazette or any newspaper. It mandates distributing copies to the UP Law Center and APO for the medical technology profession. This is done in Pasay City on the 13th day of September 2022. September 16, 2022 is the date of publication in the Philippine Star newspaper, while October 2, 2022 is the date of the effectivity. This is attested by Attorney Giorgelica T. Bautista, the Chief PRB Secretariat Division. Next is Code of Ethics. It refers to a set of guidelines, standards, and principles to promote professional behavior that are value and compliance-based. and relates to integrity, professionalism, and social responsibility as prescribed by the board with the approval of Professional Regulation Commission. The Code of Ethics was first published by the Philippine Association of Medical Technologists, or PAMET, in 1968, prior to approval of RA number 5527 in 1969, and then it was revised in 1997. The Code of Ethics was explained earlier in the previous slides, and this is the old version of the Code of Ethics of Medical Technology Profession. For the next slide is the new version of the Code of Ethics of Medical Technology Profession. This is the professional oath or yung panunumpa during the oath-taking ceremony. So ito yung panunumpa ng medical technologies here in the Philippines.